So welcome to the Roundtable on Health Literacy. Welcome to everybody who is on the Roundtable, those in the public, and of course those who are on the webcast. This will be a just wonderful, wonderful day. The topic is just extremely important, and the speakers and the agenda really well put together. So you're going to enjoy the day from the time we begin until the time we end at sometime about 5 o'clock. My name is Bernie Rosof, and I've been the chair of the Roundtable for a while. The mission of the Roundtable on Health Literacy is to inspire and to activate a wide variety of stakeholders to develop, implement, and share evidence-based health literacy practices and policies with the goals of improving the health and well-being of all people, from the patient to the professional to the system, to achieve the quadruple aim: better care, improving the health of the community and the population, affordable care, and enjoy the practice by the healthcare team. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern, such as the focus of today's meeting: the intersection of behavioral health, mental health, and health literacy. What could be more important than that intersection of behavioral health, mental health, and communication? There is a well-defined process that defines topics for the Roundtable workshops. It includes strategic planning sessions for the Roundtable members, workshop suggestions from the members of the Roundtable and the public through a listserv, and then a prioritization of the topics chosen. A planning committee is then formed. And by the way, I want to personally thank the planning committee for their expertise in putting together today's meeting, and more about that in a few moments. It is interesting to also explore the types of activities that the Academies engage in, from consensus studies to fellowships, expert meetings, to innovation collaboratives. Innovation collaboratives. And we'll be using that word innovation throughout the day. The field of health literacy has evolved from early efforts which focused on individuals to one that recognizes that health literacy is truly multidimensional and a team and system function. Health literacy includes both system demands and complexities, as well as individual skills and abilities. While communicating in a health literate manner is truly important for everyone, it can be especially important for those with mental or behavioral health issues and for the systems and teams that interact with them and treat these individuals. Although this may be self-evident, and truly many feel that it is, it requires practical and innovative applications, practical and innovative solutions, embedding health literacy into systems. Mental health issues and behavioral health are often not well understood by many primary care healthcare providers and those in the public health community. Yet many with chronic mental or behavioral health issues first access care through the primary care system. The same is also true of specialty care, as important, even though it often is not the initial portal or entry of the healthcare patient. But it is critical to effective treatment of those with mental or behavioral health issues, and that's truly an understanding of how various conditions, for example, depression, autism, and other related disorders, impact the treatment process. Specifically, the communication about health conditions, treatment, and the follow-up process. Truly, the follow-up process is something that we really must pay considerable attention to. Indeed, this requires bilateral communication in a health-literate manner. Healthcare team to the patient and family to the healthcare team. The term used in health literacy is often used is universal precautions. You really must make the assumption that most do not understand and communicate in a health literate way. And if we do that, then we can make that improvement from the very beginning. It's the same thing we do in the hospital when we make the assumption that everybody brings in bad bacteria, and therefore washing is a universal precaution, hand washing. So it's extremely important that we make the assumption that health literacy is something everybody needs to understand. For example, major depression impacts more than 16 million Americans, and those with depression often develop physical chronic illness earlier than those without depression. Such individuals have significantly lower treatment adherence rates and lower satisfaction with their healthcare encounters. Those with depression also have a lifespan that is 5 to 10 years shorter than those without. As already noted, research documents that most people in the United States cannot understand or use the complex information needed for managing their health and to effectively use healthcare services, no matter the source of the information. Now, this is especially true for those with mental or behavioral health issues and those on the autism spectrum. Health literacy approaches include a focus on the individual patient and the family. They emphasize the need to listen to the patient perspective and to communicate in easily understandable ways. Health literacy approaches can be effective tools in the understanding and treatment of those with mental or behavioral health issues. Such approaches can help align health system demands with individual skills, abilities, and knowledge. A key to successful transfer of clinical and other information. I think that's a critical point. Such approaches can help align health system demands with individual skills, abilities, and knowledge. That truly is a key to successful transfer of clinical and other information. The purpose of this workshop and the day is to explore the issues associated with effective communication with individuals with mental or behavioral health issues, and to identify ways in which health literacy approaches can facilitate communication. Again, I want to thank the members of the Workshop Planning Committee who organized this workshop. They are Wilma Alvarado-Little, Malin Andreessen, Katina O'Leary, Stephen Rush, Alan Van Biervilliers, and Teresa Wagner. I want to thank you once again for putting together this wonderful day. As I usually do at this point in the morning, I want to ask the Roundtable members to be thinking carefully as the day goes on about key points that you think are important to highlight. Because at the end of the meeting, towards the very end, I will be asking each of you to provide us with 1 or 2 sentences about important points made. That clearly is important for a variety of reasons. We do use that as follow-up and next steps for the workshop meeting, and it's very helpful to begin that process today, and we'll, of course, have further discussion about that tomorrow. I'd also like to ask each speaker to please stay within the time allotted. I'm sort of like the timekeeper here, so that all may have an opportunity to share their knowledge and we have an opportunity to have dialogue. Melissa French, Melissa, you just want to raise your hand? She will be the real timekeeper. Yeah, so we have an opportunity today to use electronics. You'll have the time in front of you and in front of you over there. And please try to keep within the time frame that will be allotted. I was going to introduce the moderator of our first panel, but unfortunately she has experienced a recent medical emergency and could not be here to be with us. That's Malin Andreessen. I'm pleased to report, however, that she's doing well and will be back to normal in a few days, I do hope. So Malin, if you're watching, thank you very much for your passion in this situation, and I know your understanding of the topic. We will miss you, but I'll do my best to try to fill in. So we will begin today's workshop with 2 speakers who will help us understand why we are so committed to the field of health literacy. They will help us understand what is to be a person with mental or behavioral health issues who may be trying to understand and communicate with a health system or health providers. I will briefly introduce the 2 speakers, and they each will make their 20-minute presentation. Please hold your questions until both have finished, and we'll then have plenty of time for discussion and dialogue about the issues. Lisa Morgan is an autistic adult, the author of Living Through Suicide Loss with an Autism Spectrum Disorder, and is a feature writer for the Spectrum Women's online magazine, a magazine for autistic women. She has a master's in teaching special education and is a board-certified autism specialist. Welcome, Lisa. Kate Fahrenholt, a lawyer, is the executive director of the National Alliance of Mental Illness in Maryland. She has developed ways to engage, support, and empower individuals with mental illness and their families to become peer leaders and advocates. Ms. Morgan, will you begin?